didn't necessarily know what was going on. Hey, and welcome back to my channel. 2 weeks ago I had my excision laparoscopy to treat endometriosis, but before I go into detail, what actually is endometriosis? So endometriosis is also known as the chameleon of gynecology. There's a broad range of symptoms which vary from woman to woman. Endometriosis is when lesions similar to the endometrial tissue grow outside the uterus. Some of these lesions can damage your fallopian tubes and inflict damage to your reproductive tract. That's why it's also known as a reproductive disease. Most gynecologists like to use hormones like contraceptives, estrogen pills, or hormonal IUDs to suppress endometriosis and slow down the rate of the growth to keep the lining of the uterus thin and help with pain. In my case, I had a bunch of side effects that I decided to stop hormones altogether. So how can endometriosis be treated? MRI or ultrasounds just cannot pick it up. So the only way at the moment to diagnose endometriosis is through laparoscopy. There are 2 ways to remove those lesions, cysts and any other scarring or things caused from endometriosis. To understand this, I will use the analogy that was used to explain this to me, as I want this to be as easy to understand as possible. The general use procedure is called ablation laparoscopy, or the slash and burn method. Imagine weed growing all over your lawn, the weed being the lesions, and then a flamethrower is used to burn those weeds down. Successful, you may think, right? But while the visible growth might be gone, the roots are still grounded in the soil. Then there's the gold standard to treat endometriosis, excision laparoscopy. Again, imagine weed growing all over your lawn. With this procedure, all the weeds are being excised or removed, including the roots. And where there is no root and nothing left, nothing can grow, right? When looking at both of these options, the ablation method or slash and burn has a higher recurrence rate, and you will most likely find yourself being surgically treated every few years. While the excision method is slightly more invasive and costly, the recurrence rate, depending on the skills of your surgeon, is fairly low though. How did I approach the treatment seeking for surgery? Once I had the suspicion of having endometriosis, I went to a gynecologist who examined me but didn't take me serious in any way and just told me my clock is ticking and I should consider getting pregnant. So I searched for a different gynecologist who examined me and listened to my history, my symptoms and concerns. She brought up the suspicion of me having endometriosis all on her own. I actually bursted out crying due to the relief and someone taking me serious for the first time. Long story short, although she offered me a biopsy, I declined as I wanted to undergo a laparoscopic excision to treat the possible endometriosis. By accident, I actually came across a video of an endometriosis specialist on Facebook who even happened to be located in Jacksonville, Florida. I immediately scheduled my first appointment for January of 2021. Fast forward, May 2021, I was laying on the surgical table. I had a lot of pre-op appointments and had to do things like bowel prep the day before the surgery and get tested for COVID. The morning of the surgery, my husband dropped me off at the surgery center as no one was allowed in the facility with me. In the waiting area, I had to sign a few papers and got my bracelets with my info and emergency contact details. Once I completed, I waited for the nurses to call me in. They weighed me, had me to another pregnancy test, which was kind of tough since I had my last sip of water midnight the day before. Anyway, I had to go through a bunch more paperwork regarding the anesthesia, my consent to perform surgery, actually personally confirming my will to proceed with the procedure. They monitored my heart rate, blood pressure, and also placed an IV on my forearm and hooked me up with some nutrients before the surgery. Then I was all set up and waiting for the nurse to bring me into the operating room. When they picked me up and pushed me through the hallway of the surgery center, a few doctors and nurses saw me smiling from cheek to cheek, being relaxed. They told me they've never seen that before if I was aware that they're pushing me into the operating room. I actually couldn't wait to have my laparoscopic excision done and to feel better. I think I have never been conscious being in an operating room, but I was amazed to see all the lights and machines. There, the nurses asked me to transfer onto the operating table, all while they started giving me the anesthesia. I barely made it, exchanged a few words, and I was out. Next thing I remember was me waking up in a little booth on my bed. Since it was a surgery center, the nurses working there didn't necessarily know what was going on and anything about my diagnosis. So while I was slowly waking up, munching on some of my snacks and sipping some water, I still didn't know if my surgery actually was successful or not. Once I was able to go to the bathroom and pee, they released me, called my husband to pick me up, and little did I know he was waiting in the car for quite some time loaded with information about my surgery. So they put me in a wheelchair, brought me outside, and Bill shared the information the surgeon has passed on to him. I was diagnosed with a mild case, fortunately, of endometriosis in my left abdominal area, my bladder, and my colon, as well as some cysts and scarring on my fallopian tubes, which all was excised successfully. I was beyond happy to finally have my diagnosis, still am, knowing that all these years the pain and all my other symptoms weren't just in my head or excuses. And then my recovery started. Thank you so much for watching. I hope you enjoyed the video. If so, give me a thumbs up, subscribe to my channel, and turn on the notification bell so you don't miss any of my upcoming videos. And I'll see you around next time.